Hi, welcome to Democrat and Chronicle Facebook Live. I'm Patti Singer, and I write about health. There were more than 700 opioid overdoses in Monroe County last year. They happened in just about every town. On January 24th, the county announced an action plan. Part of that plan is to provide free training in the opioid antidote. With us today is Dr. Marielena Velez de Brown. She is Deputy Commissioner of the Monroe County Department of Public Health, and she's with us to talk about addiction as well as Narcan training.
That's right.
We promoted this a little bit. We already have some comments on Facebook Live. We'll try to get to as many as we can during this time. People seem to be questioning why the county is doing this. Things like comments like, I didn't know we were legalizing heroin. When is insulin going to be free? Things along those lines. Talk a little bit about addiction and maybe people's misunderstandings if they don't have someone in their family.
Yeah, no, the scope of the problem is so big that we absolutely needed to respond. So in the US, there are every year about 22 million people who struggle with some type of addiction. Addiction is a chronic disease of the brain. Taking any certain substances for an extended period of time actually changes the receptors in our brains. It has a physiological impact on our bodies that can lead to a condition called dependence, where the lack of that substance then leads to symptoms of withdrawal. In this case, even taking a short-acting opioid medication the way you're supposed to, the way a doctor prescribes it to you, if you do that for as short as 2 weeks, your body can become dependent. Your cells get used to having it, and they start not functioning as well without it. So once someone has developed that tolerance, they can continue to take that medication just to avoid feeling nauseous, shaky, sweaty, irritable, and over time that can move from use to dependence to misuse, and then at the end of that spectrum is what we call the chronic disease of addiction. But this is not that someone chooses to do this. This is that a substance in their body has a reaction and changes their physiology to make them dependent and need that substance.
Okay, so maybe this is a bad analogy, but I'm allergic to certain fruits. All right? So if I eat a fruit, I have a reaction. There's a way of knowing that. I can be tested to see if that's going to happen. Now, is there any, first of all, does that analogy work with addiction? Is that something happens that triggers this reaction in that person? I can't eat an apple, but you can and you're fine. Yeah. Is there any analogy like that with addiction, with substances?
It's very different in the case of addiction, because all of us, for example, have opioid receptors in our body. They help regulate pain, nausea, and so any person who takes this medication has the potential to become addicted. Some people, for genetic reasons that we don't fully understand yet, may have a higher likelihood or a propensity to develop an addiction, but we don't have a test to tell, oh, you shouldn't get this opioid for your abdominal surgery because you're more likely to get addicted. There's genetic factors that play into whether a person is more likely to get addicted or not, and then there are also environmental factors. So if you're in an environment where people drink and that's normal for you, then you might be more likely to try it. And if you have had some prior trauma in your life, we know that people who, whether that's a physical, a sexual assault, emotional, physical abuse, those folks tend to have a higher risk of becoming dependent and addicted once they're exposed to certain types of substances. But there's no tests that we have that can say this person is likely to become addicted or not.
So that's a little scary for someone who may be approaching a knee replacement surgery, hip replacement, any type of surgery. So is that why now we're prescribing, it's being prescribed the least amount, for the shortest time?
I think that the decrease in provider prescribing behavior is actually a direct result of the opioid epidemic and this epidemic of overdose deaths due to opioids. But don't get me wrong, if I was getting a knee replacement, if I was getting a big abdominal surgery, I would want to use this medication because it's really good at controlling pain. But I think it's important, and now providers and prescribers are having more of a conversation with folks about the potential danger. We understand much better the addictive nature of these substances, and so we can appropriately counsel our patients, use it for the shortest amount of time, and now we can think about using other classes of medications, so supplement with Tylenol Tylenol, ibuprofen, and wean people as quickly as possible. But in the state of New York, there is now legislation that providers are not supposed to write a prescription for longer than 7 days of these medications, because if you have really, really terrible pain that requires the use of an opioid for longer than that, you should be coming in to see us. And we know that longer time periods than that can lead to tolerance and addiction.
So that would, even for somebody who was coming off a surgery, they would still just get that 7 days, and then come at your follow-up, they would come and assess your pain to see if you needed more. Do
you need more? Is there some complication brewing that we need to address? But yes, that's exactly right.
So Narcan, this is the brand name. The naloxone is the generic name. People could see it could see that both ways. So the county is offering this free to people who are interested. Is a direct response to all of these overdoses that we've seen?
Yes. So we went through the process to become a New York State opioid overdose prevention provider. So that means the State Department of Health is providing us these kits for free. It also comes with gloves and a mask if you know how to do rescue breathing if someone has stopped breathing. And so we are now able to train people how to identify an overdose, give them a little bit of education about what addiction is, and then explain what Narcan is, how you use it, and encouraging everyone to call 911.
What's been the demand so far?
Well, it's very recent that we've been offering this to the general public. We started focusing on many county buildings and equipping the personnel, security guards there, so that we would have it available in county buildings that are open to the public. And so now we're taking anyone who's interested. So we have had some folks from, for example, homeless shelters or soup kitchens come in, some students that were interested, and we put a letter with all the restaurant permits that were mailed out at the end of last calendar year, inviting restaurant owners and business owners to come and be trained and have this on hand in their facilities.
Which makes me think of an AED.
Yeah.
I mean, restaurants, are they required to have, restaurants or public buildings required to have an AED?
I don't believe so.
Okay. But yet a lot of them have them, and you'll see the sign,
Mm-hmm.
here's where the AED is, and you see a sign that says, here's how to do the Heimlich maneuver. Mm-hmm. Where does something like this fit into, I guess, a public's response to an emergency situation?
I see it very similar to the use of an AED, because an AED is just a tool you can use in case of an emergency. And this is another tool that can be in someone's emergency response kit that can be used in the case of an emergency. Obviously, if someone's having a heart attack, giving naloxone isn't going to help. But by the same token, if someone is having an opioid overdose, giving them a shock with an AED isn't going to help them either. So it's just another way for businesses or physical locations to be prepared in a worst-case scenario.
Okay. The AED will talk you through it. You open it up, and, and there's a voice, and it says, do this, do that, shock, don't shock, whatever. Even though you're supposed to have training in using it, a bystander could conceivably do that.
Yes.
Signs or symptoms, I mean, how would I know to reach for the Narcan?
So the way people end up in an opioid overdose is that these opioids, while they treat pain, they also hit the receptors in your brain that control your breathing. So people who are in an opioid overdose will breathe slower and slower until they stop breathing. So that's one main thing that anybody could notice. Either someone's breathing strangely, they sound like they're gurgling or struggling to breathe, or they've stopped breathing altogether. Another thing that opioids do is that they constrict the pupils. So if someone's pupils are very, very small and they're not changing, even if there's changes in ambient light, that is another suggestion that this person could be suffering from an opioid overdose.
I know, when you take CPR, they say, tap and shout kind of thing. What are you supposed to do if you're thinking of come upon somebody? Yeah,
so you would shake someone, you would tap them. Sometimes we talk about this technique called the sternal rub, where you just kind of take your fists and rub on someone's breastbone really, really hard. Because even if you do it to yourself not that hard, it's kind of a noxious stimulus. If you're at all conscious, you're going to wake up and try to make someone stop doing that to you. So that's another technique that folks can use to identify someone who's really overdosed and not breathing, not responding.
The instance where someone would come upon this, if you don't have a family member, you don't think you're in that community, is it sort of the same as I'm in a restaurant and someone's choking and I have to do the Heimlich? I mean, how commonly might somebody come upon
It's
this?
unfortunately really, really common. This opioid epidemic is the great equalizer because a CEO, highly educated person could become addicted, and a teenager, you know, just experimenting with pills at a party could be exposed. So we've had reversals occur in some of the public libraries. We would love to get Narcan into churches, into any public facility, because anywhere where people can congregate, it is possible that someone could go there and have taken a substance that is going to lead them into an overdose.
You think of it being instantaneous. You know, we hear now about heroin or fentanyl and heroin mixes, and someone injects and the overdose is right there. But could it happen over a period of time?
It could take some time. Yeah, it depends, unfortunately, on the way that people are consuming the opiate, whether it's a prescription pill or heroin, as you mentioned. If heroin is snorted, it doesn't have its effect quite as quickly as if you inject it. If you take a pill, your body has to digest it, and then you have to absorb it. It has to get into your brain and then have those effects on the respiratory centers in your brain. So the length of time it takes from when someone consumes the substance to when they actually slip into the overdose is variable. And also it depends on the potency of whatever substance they took. As you mentioned, fentanyl is much more potent than OxyContin. So a person who takes some of that, whether they did it on purpose or whether, you know, a bag of heroin was laced with fentanyl and they just didn't know, that time is going to be very different.
So what do we have here?
Yes.
Explain to what we've got.
In our kit, we have the naloxone. It does come with some instructions on how you identify the overdose and how you open it and how you use it, and the fact that one should call EMS, Emergency Services 911, and put the person in what we call the recovery position. But when you open these boxes, you're going to get a piece of paper that has all the information, but then you'll also get 2 blister packs. Sorry,
that
they look like this. And I'll give you this one.
All right.
And you can see that it just has the regular pull-away foil that one would take.
Okay.
And so this is what it looks like. You would put your 2 fingers on the top, and then before you go to give the medication, I would suggest you put your thumb on the side, the way I have it here.
So it's kind of like that?
Yes,
all right.
Because yours has already been deployed, but
okay.
you can see here on mine that it hasn't been deployed yet. So
oh, okay, this is mine. Yeah, I got you.
Yours has already been used
okay.
To demonstrate. So you would literally put this into someone's nostril and then put your thumb on that little part and push up. Okay. And it will spray a mist of the naloxone into someone's nose. And then if you know how to do rescue breathing and you're comfortable with that, you could do that. If not, we would definitely still recommend that people call 911, because even if we give a dose of naloxone, it tends to work for anywhere between 30 to 90 minutes, but depending on how far you are away from EMS and how much opiate a person has taken, they may start to revive, but then they might kind of slip back into an overdose when this medication wears off. So that's also why we give 2 doses in each box.
Okay. So, and this is like commercial nasal sprays if you have, you know, congested nose or whatever. So if we were supposed to be truly participatory journalism and you were to put that in my nose now, I am not not in an opioid overdose. What happens, you know, if kids were to get into this or something like that? What happens if you were not in an overdose situation and you use this?
Absolutely nothing. So this medication only acts on the opioid receptors in your body. So if you haven't taken an opioid, if you haven't taken a hit of heroin and you get sprayed with this, it will do absolutely nothing. It will have 0 effect. It'll be like spraying your nose with saline. Okay. Like water.
All right.
So folks should be empowered to not be afraid you're going to cause someone harm by accident. You can't hurt anybody with this because it only acts on the opioid receptors.
Now, is this, so someone who takes the training from the county, is this kind of packet what they receive, or does it come in something that's more like fanny pack-ish or something that's a little easier?
We do give a little bit of another kit that contains gloves, and it also contains a face mask. It looks like a piece of cellophane, basically, that you could put over someone's mouth so that you could give them rescue breathing if you know how to do that, if you felt comfortable. If you don't know how to do that, if you've never been trained on CPR, then we recommend that you not waste time trying to do that and give ineffective breaths. Give the Narcan, and call 911 and get the person the long-term care that they need.
Okay, so you, all right, so one of these has been deployed in the person. So now what do? You've done this, what do? You go back and tap and shout again?
Yes.
Or how do you handle this after you've deployed this?
Exactly. If someone was in an opioid overdose and they've taken a small enough dose that this will cover and reverse that overdose, then the person will start to wake up, they'll start breathing again, and you will essentially have put that person into instant withdrawal. So that person will start feeling all of those symptoms of muscular, joint pain, nausea. They might vomit. Some people have diarrhea. People get shaky, certainly wake up very irritable and kind of disoriented. So what we recommend is that if the person starts waking up, but they're not super aware of themselves, that you put people in the rescue position, which is where you lay someone on their side with their arms supporting their head, because if they are to vomit, we don't want people laying on their back so that then they'll breathe it in and aspirate it into their lungs. We really want to put people in this safe position. And then just stay with the person, try to explain what happened to them, keep them from taking any more substances, and really wait for 911 to arrive.
Can this be, we hear about people being revived repeatedly with Narcan. I mean, is that some of the controversy around Narcan?
You know, you hear that some people are afraid that, oh, someone on purpose will have Narcan on hand so they can take a bigger hit and get a better high and know that they can be brought out of it. That's really the minority of the cases where we're seeing that this is being used. It's either someone, people at risk of having an opioid overdose are either those who don't know what's in their supply, or maybe you used to take OxyContin and now for whatever reason you've run out of that, so you take a different medication and you didn't realize that one pill of that medicine is more potent than what you used to take. So, or someone whose dealer changes or whose dealer has started contaminating their supply of heroin, lacing it with other things. You take the same amount, but you're getting a much more potent medication. So most of these the vast majority of these overdoses are unintentional.
Well, a comment from somebody said that, how about people like me that are addicted but don't abuse them, that opioids needed for extreme back pain? So this person needs this medication, and yet
I would definitely recommend that they have some on hand, that their loved ones or someone living in their home would also get trained in this, because it is still possible for people to unintentionally overdose. Or, for example, if people combine medications, for example, benzodiazepines like Valium, Xanax, if you take that, or alcohol and an opioid, then they have a synergistic effect. They're both depressants, and so it still might cause a stronger reaction in your body than you anticipate. So yes, I actually, one of the recommendations we're making now to providers is if you give your patient a prescription for an opiate, then you can also write them a prescription for Narcan so that they can have that on hand. But even without a prescription, now there's a program, it's called the Standing Order from the New York State Department of Health, where anybody can go to a pharmacy and request Narcan, and it can be dispensed to them without needing to have a prescription that was written specifically to Patti Singer from Dr. Velez de Brown. Anybody can go to the big chain pharmacies, Wegmans, Walgreens, all of them, and request it, and it can be dispensed. Now it is billed to your insurance, so there may be some cost associated with it, but to overcome that barrier, the New York State Department of Health has also instituted this naloxone co-payment assistance program, where a pharmacist can put in this code, and then they can bill the New York State Department of Health up to $40 of your copay. So it's definitely recommended that anyone who's appropriately taking an opiate should have this on hand just in case.
As I say, okay, so many years ago I had surgery, and it was, at that time it was stay ahead of the pain, here's all your pills, exactly. 30 pills, the whole bit, and every 4 hours and whatever. But so now if I were to have that same surgery now, I would get 7-day supply, and would I get a prescription for this?
That would depend on your physician. Obviously, we're encouraging our providers to do that, but you certainly as a patient should feel empowered to talk to your doctor about that. If you are not automatically given that prescription, have that conversation. And it's also just helpful to have around, because as you said, if you have children and someone else gets into your medicines and accidentally overdoses on a medication that was written for you, well then it's good to have this on hand to be able to act immediately and not have to sit and wait for 911 and have done nothing in the interim.
So that's interesting. I guess I didn't realize that if you go for what, okay, quote unquote, legitimate use of a pain medication, as charged as that, air quotes may be, you can say to the doctor, Dr. Velez de Brown, shouldn't I have, you're going to write me a Narcan prescription as well? It almost paints that opioid medication as it's going to cause you an addiction, so we're going to counteract that.
It is just the nature of the substance that it is possible for anyone to become addicted, and so I think a proactive patient should be able to have that conversation with their provider and not be perceived as a drug seeker who's just trying to get high. I think there is enough data and there are enough overdoses that we can all recognize this is a huge problem, and for the sake of the patient and also the sake of people that patient loves, it's important to have it on hand. Young people who say on national surveys that they took an opioid for non-medical purposes, they often get it from their parents, their friends' medicine cabinet, and so it's important to have it on hand to protect other people around you as well.
So I'm thinking of another analogy, maybe worse than the first one, but we think about EpiPens. Always carry an EpiPen, and we know prices of EpiPens, and I understand people are going to comment about that, but I'm just using the analogy of something that can prevent a problem. You know you are susceptible to a bee sting. You know you have to take the opioid because you just had the surgery. So you have the Narcan.
I think it's always better to be prepared and have the medication on hand and not need it than to need it and wish you had had it available to you.
Is there expiration on this? We know some of the medications that are sort of antidotes to things are, you can only have them for a certain period of time.
Yes, so all medications have an expiration date. The good thing about Narcan is that the studies have shown that this expiration date that's printed on the box is really only an indicator of when the medication starts to lose some of its efficacy, but it still is useful. Anyone who takes the training from the health department, we give them a form and we ask them to make sure that they check the expiration date. If your Narcan expires, we're happy if you just send us that form telling us it's expired, we're happy to provide another dose. But you wouldn't necessarily need to throw it away because partially effective Narcan is better than none. And
you still have two, so that if you deploy one, should you then get a new double kit?
I would say yes, because many folks, unfortunately now with the strength of the opioids that are out there on the market and in the streets, some people are requiring 2 doses just to have that initial coming back to breathing and being reversed. So,
final thoughts about the fact that any of us could become addicted if we were exposed, and Narcan. Anything that you want to leave people with that you should remember?
I want to try to change the stigma and the conversation around this addiction and this addictive behavior as a choice, because addiction is a chronic disease of the brain. There are physiological changes that are happening. No one wakes up one morning and says, I want to become addicted. It is an unfortunate reality, and we do need to address prevention and get people into treatment. But in the meantime, this is a really good measure to try to keep people from dying when this is a preventable death.
Dr. Marielena Velez de Brown, the Deputy Commissioner of Monroe County Department of Public Health, thank you so much for joining us here on Facebook Live.